My name is Terry Beckman, and I'm a business coach and consultant. I'm also a small investor, and I actually have 3 questions. So the first one is I really appreciated David's PowerPoint, and I'm wondering if we could have access to it.
Oh, sure.
Maybe Greg could put it on his website.
We can put it on our website.
Sure.
That'd be great, yeah. So one question, you know, I do see most people obviously live in private housing, and I think in the Southeast, most people live in little single-family homes, right? And as an investor and working with investors, I also see they and their subcontractors don't know very much about renovating healthy housing. Right. So I'm curious if there's been any work around that. Like, just for me, I'm like, well, are there some good sources to go to, just even to see, like, what would the standard specs be? You know, I'm a little familiar with Enterprise's work, but that tends to be multifamily focused, I think. And then has there been any thought about the national housing codes and how to get some of that potentially inserted into that?
Right.
Is one question. And then I have a question for Marty.
Well, so on the codes do we have any code inspectors here? it's sort of,
speak up now.
Well, it's been a mixed bag, frankly. So if you go back to the early 90s, we kind of gave up on the code folks because they said, we're not qualified to do these sorts of health-based inspections. We'll refer that to the health department. And so we kind of, this was for lead, and we kind of said, well, okay, if you guys aren't going to do it, we'll go to Congress, and we did. We set up a whole new industry of lead inspectors, lead risk assessors, and lead abatement contractors. And you can argue about whether that was the right way to go, but we did it because the code inspectorate is not adequately professionalized. So one of the things that needs to happen is that the code inspectorate in this country needs to get credentialed properly so that they're qualified to investigate health defects in housing. If you go to Great Britain, I keep touting Great Britain, but those guys all have master's degrees. Their code inspectors have master's degrees. It's not like that here, right? So now we anchor with, I think, 20 different universities around the country, a Healthy Homes credential that you can get through the National Environmental Health Association, and that will do it. The other thing with codes is that that's the purpose of the National Healthy Housing Code. It's to integrate those health considerations into the typical housing code process. With regard to spec development, the Healthy Housing Challenge, there are some specs in there. These are mainly sort of volunteers, but most of the volunteer work is done in single-family housing. And Enterprise does also do single family. It's not all multifamily. So I think there has been, there are specs out there that can be obtained to figure out, you know, what are the key things that should be done to a particular, and obviously it depends on the condition of the house. I'll just highlight this one thing. The hardest thing in these sort of upgrades is ventilation. And that's sort of a key thing. You have, you know, a lot of these houses don't have adequate ventilation to begin with. That's a key housing concern, but there's also an energy penalty to pay if you upgrade it. So I think that's worth highlighting. But the standards are increasingly there. The spec developments are there. They simply need to be, you know, made more mainstream, as you're suggesting.
Yeah, I think ventilation and moisture also.
Yeah, that's
and there's
right.
a lot of debate about what to do with moisture. Can I ask Marty a quick question? And that is, I'm very interested in the role you see of private payers in influencing this, because you talked a lot about Medicaid, but many poor people now are under the Affordable Care Act and are in the private payer system. Have you seen any examples of how that how their role could potentially impact this in a positive way? Is there anything going on nationally?
There's very little so far. I think it's possible that that will happen. If you look at most states, what they did with, they had the choice of expanding for the low income up to 138% with Medicaid, and now a couple of states are going with private payer systems for even that population. So that'll be a good place to look. And they're getting a little bit of trouble getting approved by CMS, but Arkansas, I think, is one. And then the private payers, by the way, when you talk about the role of private payers, sometimes they're hired to do some of the Medicaid work, so they actually do have more experience with individuals in low incomes. And I think that they will be persuaded to be more involved with the help of the institutions they're working with the hospitals, for example, who seem to be willing to be at the table, whether it's, you know, it's in their own interest, right? It's in Wake Med's interest. But they have a reason to be at the table. And then I think that'll bring the private payers. And remember, back to the private payers, we're talking about a lot of managed care organizations who do both the public work and the private work. And I was at a meeting yesterday in the Carter Center, and my session was on housing and where are we going in the future. And all the managed care guys came into that session. There were 3 or 4 big companies. So I think I've seen 2 of those big organizations take on using some of their own money now, their own earnings, and because they have a skin in the game. Because if they can reduce their cost and they can see it, and they have, by the way, their data systems are a lot better than some of the public data systems. So once they're being able to see it, I think they can also come to the table. Local health directors, state health directors, we were just talking about Mitch Katz in Los Angeles, who's looking for 15,000 units of housing. Talk about collaboration. You can do it at the local level. You'll still have to have the state level when it comes to health policy and support from the federal level, but there are lots of good local examples. And yes, I think private payers will get to the table when it becomes clear that it's in their best interest.
Well, actually, it's not a question. I'm Byron Waters. I'm with Rural Development. I've got an answer for your question. You want to know where to find contractors that for single family that know how to build and again, I'm with government, but I'm going to tell you, the answer to your question is Earthcraft, at least in the Southeast. It's earthcraft.org, and I'm recently here from Virginia. The chapter in Virginia actually trains contractors. They have a program of seminars of how to build green, how to go. Their philosophy is above and beyond the code, and so if you that's one answer to your question, how to find those resources. If you want to build a healthy, energy efficient, integrated housing system on a single family, check out earthcraft.org.
Yeah, I think that's a good example. Just one word of caution. I Googled green building systems at one point, and there were 38 of them, different systems out there. So they're not all created equal, is the point. Earthcraft's a good one. LEED is sort of the gorilla on the block. I would note that LEED actually doesn't have health requirements. Really, you get extra points, but they don't have a requirement. The enterprise system actually has requirements. There are other systems out there as well. So it's sort of like Kermit said, right? It's hard to be green, but just buyer beware there.
Bad.
You're like, sorry.
It's terrible.
I had to get one bad pun in. Right?
I'm Evan Covington-Chavez. I'm on the board of DHIC. I have a question for guidance for those of us who are developers and things like enhancing sidewalks and fancy playgrounds and anything that's not actually bricks and mortar on the house or the development, but may have access to a large development. How do we make that something that's not an afterthought when we go into planning a development? How do we make those pieces of that project something that aren't considered as a, oh, by the way, we should have thought of that a year ago when we were sitting down to start planning this out?
So the question is, how do the neighborhood level improvements?
Yeah, I mean, if we're talking about, you know, 10, 20 acres of land, we are able to develop, and we could put housing on every single inch of that if we wanted to. Mm-hmm. Should we, and if we don't, then how do we be thoughtful about not making the other aspects they become amenities, right? They become like, you know, DHIC got a bunch of public press about the fact they put a pool in one of their developments, which in my mind could also be a place for exercise. You know, that becomes an extravagance, an amenity, something that's not affordable. How do we account for those things when we are thinking about developing these large projects as integral and important as the units of housing we're putting there, and then who should we be tapping in the beginning to inform us as we're developing it?
Are you talking multifamily?
Both, multi and mixed use. Like
Okay,
if we were to have
well,
different, both multi and single family plus commercial or anything.
Well, you know, I haven't read I try not to read too many QAPs. I think it reduces your brain cells after a while. But there's policies being made in every year. Every state is reviewing their policies on their qualified allocation plan for tax credits. And you will see the exercise rooms be required, for example, or the, you know, extra points for the green space. There's lots of ways you can do policy when you have those kinds of policy documents, and they can drive, and that has to come out of your financing. So you're absolutely right. It's better to do it ahead of time than oops after you're done. Think about if you've ever remodeled your home and you said, oh shoot, I should have done this because I'm not going to tear up that floor again, and I really did want that heated bathroom floor, which is I'm still screaming about. But I think that's one way to do it, is to say that. Obviously, if local communities want to make statements here, they can begin to do that. We've seen, back to the FQHCs, for example, you know, who's planning, when you're going in, for example, in Philadelphia, if you want to go in today with a big project to, you know, tear down some public housing and come in, one of the very first things that's going to be asked in that discussion is, are you going to co-locate a health center? Mm-hmm. And that's got to be in the policy up front. And I think, by the way, if you ask the people who live in the neighborhood what they want, then you might get a really good answer right next. So up front.
Yeah, I think it's almost a philosophical discussion. When does an amenity become something essential? Yeah. Right? Amenity implies you don't really need it. Sidewalks, that's an amenity. And I mean, 40 years ago, you were required to put in sidewalks, right? It was sort of a no-brainer. It was expected. Now, not so much. So I think I don't have a clear answer for it. There is neighborhood level things. I think this is part of the planning world that, frankly, needs to be brought back into this discussion as well. I mean, there's a housing group, there's a planning group, and then there's the health world. So the planners, I think, have a lot to say about connectivity, opportunities for active living. I showed the active design criteria. Right now, I mean, it's an interesting question, because a lot of these green systems, they're not technically required, right, in a lot of places. They're a good idea, and people architects compete for the green designations. So it's kind of been all voluntary, and you can make a lot of mileage that way. And it seems to me some of these neighborhood level interventions are also important. I would note, as an example of that in the Superstorm Sandy rebuilding efforts on the East Coast, HUD actually required, as part of its CDBG disaster recovery funds, that when you rebuild, you have to rebuild green. Now, they didn't say exactly which green standard it was, but that's a step in the right direction, because it says, we should rebuild not just the housing unit, but also the way in which these communities are designed. So I don't think it's a great question. I don't know that there's a clear answer, except to argue that some of these things need to be reflected in qualified allocation plans and other financing mechanisms, along with mortgage underwriting standards. I mean, you were speaking of some of how do we finance this stuff in, unassisted stock, which dwarfs the stuff that's assisted, and one way is to do it through mortgage underwriting requirements. That's right. So the banks are part of this equation as well.
It's amazing what we're very close to considering essential today. When you see this, and the changes in the QAPs have been dramatic in the last 3 or 4 years with respect to people with disabilities, with respect to efficiencies, with respect to the amenities. We've seen more dramatic move in those QAPs than probably the whole history of those policy documents. Not universally across the country, but in many states.